This public service announcement is on the emerging evidence documenting the potential long-term changes in cognitive functioning that result from a COVID-19 infection. From individual reports of long COVID and brain fog to large-scale quantitative studies, there is increasing evidence to support the hypothesis that COVID-19 infection is associated with cognitive deficits that persist well into the recovery phase. We are seeing several aspects of cognitive function impacted post-infection, including problem solving, reasoning, and visual spatial planning, all related to aspects of executive function. In some cases, we are seeing impairment in sustained attention, but most simpler functions tend to be spared. These deficits can have varied impact on daily functioning, including feeling less efficient in one's work, word-finding problems, difficulty following conversations with family, friends, and coworkers, managing finances, and even activities such as grocery shopping and managing medications. It appears that cognitive deficits may vary in scale with the severity of respiratory symptoms, with greater deficits in individuals who are hospitalized and required ventilator care. However, even those individuals with milder confirmed cases demonstrated similar deficits to a degree. In one large study by Hampshire and colleagues, the reported cognitive deficits could not be explained by age, education, other demographic or socioeconomic variables, and deficits remained even when other residual symptoms remitted. Premorbid cognitive functioning also could not account for the deficits. The prevailing hypotheses for the mechanisms underlying the cognitive deficits involve mild brain damage that occurs as a result of the infection. How this damage occurs can vary. We know that COVID-19 can damage the brain directly in cases of encephalitis and strokes, to the degree we might see in someone with a brain injury. Silent strokes have also been implicated. Silent strokes, which often go undetected due to the lack of noticeable symptoms, typically affect white matter. Whatever the cause, whether it's a stroke or an indirect effect to the respiratory dysfunction incident to COVID-19, we know that lack of adequate oxygen to the brain can contribute to cognitive deficits. Researchers are also considering the role that chronic inflammatory processes may have in the cognitive consequences. Despite what we know, we are still seeing cognitive deficits in individuals with no known direct injury from the mentioned causes, suggesting the underlying mechanisms can be quite complex. Many COVID-19 survivors are reporting long-term cognitive changes, further supporting the experience of long COVID. The cognitive deficits are largely related to executive function and may vary in scale based on the severity of the infection. We also know that COVID-19 damages the brain, but the mechanisms may vary. Survivors who experience overt causes of brain damage report cognitive impairment. However, even those individuals who had mild cases of COVID-19 and did not experience clear neurologic events report impairment, suggesting subtle but insidious brain damage. So what can psychologists do to help? It is important to stay current on the research and educate ourselves, colleagues, and patients or clients who may be seeking consultation regarding these long-term effects of COVID. Psychologists can also engage in cognitive assessments with individuals who are reporting these concerns, as well as seek out or make referrals for more comprehensive neuropsychological testing. It's helpful to understand the nature of these deficits so that we can implement or provide compensatory strategies to lessen the impact that the deficits can have on daily functioning and quality of life. Making lifestyle changes to support brain health can also be important for brain recovery, as well as for mitigating the risk of future decline. These lifestyle factors include a healthy, balanced diet full of protein, fruits, and vegetables, physical activity, consistent quality sleep, stress management, and meaningful social connections.